The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to OP's Data Integrity and the OP Patient Portal. This is part 2 of our webinar series. As you'll recall from part 1 of our Data Integrity and the OP Patient Portal series, we can ensure data integrity by performing data governance. Data governance is the process in which we ensure the validity, accuracy, and organization of our data so that it can be successfully received into your patient portal. Simply put, if we don't care about the quality of data going into our databases, we can't expect to feed quality data out of our databases. In part 1, and today in part 2 of our data integrity webinar, we will be exploring different areas in OP in which we will need to perform this process of data governance to support our system's integration with the patient portal. In this session, you will learn how to prepare your OP for the new OP patient portal. We will be reviewing appointment types, visibility settings, as well as how to archive database records. Our first activity, we will be going through how to perform appointment type cleanup. In order to ensure that all appointments flow to the patient portal, we will review the 3 places in OP that appointment types are used. We will be looking at scheduled appointments, visit templates, as well as patient chart defaults. For each of these 3 places, we will be running a SQL to make sure that there are no appointment type mismatches. We want to make sure that the appointment types attached do indeed match a valid appointment type found in our appointment type table. Please note that in this activity, we will be accessing the database viewer. In order to access your database viewer, you will need this following permission: tools_db viewer. The first thing that I will be doing is navigating to the linked SQL, which is our invalid appointment types on scheduled appointments SQL. We have included the links to all of the resources we will be following in today's session, and you all will be receiving a copy of this slide deck with those attached links. So let's begin. I'm going to begin by opening up our invalid appointment types on scheduled appointments clip and save article. This SQL identifies appointment types on scheduled appointments that do not match an appointment type in your system. Below in our caveat section, we see the need to knows or gotchas when running this SQL. The first caveat is that after running the SQL, if there are no results returned, that means that no action is necessary on your part. However, if there are results returned, you will need to edit the appointment shown so that it now includes a valid appointment type found in your appointment type table. Let's begin. I will begin by clicking on our copy button here to copy the following SQL text. I'm then going to navigate out into OP and access my database viewer. I'm going to navigate to my Tools section in my ribbon and click on my Database Viewer button. This will open up my OP Database Viewer, and I'm going to navigate to my SQL tab. Please note that you may already have this SQL saved into your database viewer. And if you do, you'll be able to find the SQL by clicking on the query name dropdown and finding the SQL named OPN_appointment type. However, if it's not saved in your system, you can follow the following steps. In your SQL text box, you'll paste the SQL text that you had copied, and we'll click Run. In this example, no results were returned. If you'll remember, our caveat is that if no results are returned, then no further action is needed on our part. However, had results been returned, we would follow the following steps. 1, we would navigate to and open the appointment shown. Step 2, we would navigate to our appointment type dropdown and use the dropdown menu to select a valid appointment type from our appointment type table. And then step 3, we would save that appointment and repeat steps 1 through 3 for all results of the query. The second SQL that we are going to be running as part of our appointment type cleanup is our invalid appointment types associated to visit templates SQL. Let's take a look at that article together. This next SQL is going to identify appointment types that are attached to visit templates that do not match an appointment type in your system. In this example, we have included a sample image of what this SQL report will look like. If results are returned, then what we'll need to do is navigate to the visit template shown and edit the associated appointment type to either remove it or select a valid appointment type in our appointment type table. As with before, if the SQL returns no results, then no further action is necessary. Let's begin by copying the SQL text by clicking on our copy button found here. I'll then navigate out to OP. Again, from within our Tools tab, I'll open up the Database Viewer. We'll navigate to our SQL tab and paste the SQL text that we had just copied. We'll then click on our Run button. As you can see, in this example, we do have results returned. This means that further action is required on our part. We do have quite a few results returned, so you do have the option to save this SQL or print this SQL, and then you can delegate this to other staff members to help you with this appointment type cleanup process. The first thing that we'll need to do is note down the first template name. This is our abdominal pain, less than 2 weeks template. We'll then navigate out to our template editor, which can be found from within our clinical tab by clicking on Encounter Templates. Within our Encounter Template editor, we have the ability to search for templates. I will type in the name of the first template that we saw on our query result. That was our abdominal pain less than 2 weeks template. I will click to select the template and click on my Edit button. Because the result was returned, that lets me know that the appointment type attached to this particular template needs to be updated by either clearing it out or updating it so that it now reflects a valid appointment type found in my appointment type table. I'll begin by clicking on my Edit pencil, and I'm going to update my appointment type by clicking on my Edit ellipsis button. This will open up my Choose Type of Appointment window, from where I can now select a valid appointment type that's found in my appointment type table. So I'm going to change it from Sick Visit EST to my Sick Visit Established appointment type. I will click on my red arrow to apply these changes. And save my changes by clicking on the green check mark. You would then return to your template list and repeat these steps for all results found on that query. If I were to rerun the query by navigating to my database viewer once more, and running it, I would see that that abdominal pain is no longer a result on this query. Let's recap. After running the invalid appointment types associated on Visit Templates query, we navigated to the template editor. It could have been the Encounter template or Well Visit template editor, and selected the template that was listed as a result for us. We then clicked on our Edit button for that selected template and selected our Edit ellipsis to open our Choose Type of Appointment window. Within our Choose Type of Appointment window, we then selected a valid appointment type found in our appointment type table. Step 5 was clicking our red back arrow to apply our selection. We then saved the template by clicking on our green check mark. And if we had multiple results returned on our query, we would then be able to return to the template list and repeat steps 1 through 7 for all results of the query. Our last SQL that we will be running as part of our appointment type cleanup is our invalid appointment type default in patient chart. Again, I'm following the link that has been included in this slide deck. And this will bring me to our clip and save article for this query. In this SQL, we will be identifying patient charts that have a default appointment type that does not match an appointment type in our system. We have here another sample image of this SQL report. As with the previous two SQLs, if no results are returned, that means no further action is needed on your part. However, if you do have results returned, you will need to navigate to the patient chart shown and edit it to either remove the default appointment type or update that default appointment type so that it now reflects a valid appointment type that can be found in your appointment type table. We'll begin by copying the SQL text by clicking Copy, navigating out to OP. Within our Tools tab on our ribbon, we will open up our database viewer. We will navigate to our SQL tab and paste our SQL text here. We will then click Run. In this example, I see that I have one result returned. As you'll remember, our next step will be to navigate to the patient chart shown. I need to open up patient chart 194. Let's begin. Navigating to my clinical tab, I'll click on patient chart and type in 194 and select the patient. I'll then navigate to the Notes/Additional Info tab. And this is where I'm able to update the default well visit type. so that it now reflects an appointment type that is valid and can be found in my appointment type table. Remember, you can either clear it out or update this. In this example, I will choose to update it so that it reflects a valid appointment type by clicking on my drop-down arrow and selecting Well Visit Established, a valid selection in my appointment type table. I'll then save my changes, close out of the patient chart, and remember, if I now were to rerun that sequel, because I have updated that appointment type so that it reflects a valid appointment type in my system, we would expect that when rerunning this sequel by clicking Run, we no longer have results returned. Let's recap. After running the sequel, if results are returned, we, step 1, navigated to and opened up the patient chart. Step 2, we clicked on the Notes/Additional Info tab within the patient chart. We then navigated to the default visit type to either clear it out or select a valid option from our drop-down list. We then closed the chart, and if we had more results listed on our query, we would repeat these steps until we no longer have results returned. Appointment type mapping from OP to IntelliChart is a vital piece of data integrity. In order for our scheduled appointments, visit templates, and patient chart defaults to map correctly, we need to ensure that we've performed our appointment type cleanup so that at each of these 3 places, the appointment types associated match a valid appointment type that can be found within our current appointment type table. Let's move on to activity 2. In activity 2, we will be reviewing visibility settings on our chart items to make sure that appropriate records are either being sent to or withheld from the patient portal. Patient privacy is important to consider when preparing your OP for the portal. Patient charts must be reviewed to ensure that the correct visibility level is selected on patient visits, medications, as well as problems, just to name a few places. Why is this important? You'll remember that records with a visibility level of any staff member are appropriate to be displayed on the patient portal. So if certain records should be withheld and should not be flowing automatically to the patient portal, we need to update our visibility level. Some items that can have restricted visibility include, at a global level, care plans, diagnostic tests, medication favorites, as well as surveys. We can also make changes to visibility at a patient-specific level to allergies, diagnostic tests, documents, visits, notes, medications, messages, problem list items, as well as surveys. We have included a link to this slide deck to an article that reviews where visibility restrictions can be made in OP. Let's take a look at that article together. Our Set Visibility Level article lists a number of different places where we can edit visibility in OP. In today's session, we will just be looking at a few of these places together. However, we do encourage you to review this article to look at more than just the items that we discuss in today's session. Let's navigate to OP. And the first place that we want to review visibility settings is our global medication visibility setting. We can view and make changes to our global medication visibility settings by navigating to our clinical tab and selecting our medication favorites button. An example of medications that we might want to restrict from flowing automatically to the patient portal could be our oral contraceptives. Let's take a look at that category. I'll begin by expanding my oral contraceptives category. And in this example, let's select our Yasmin oral contraceptive medication here. I'll click on my edit ellipsis. And here I can see my privacy level is currently set to any staff member. If I want to restrict this particular medication from flowing automatically to the patient portal at a global level, this is where I can change the privacy level from any staff member by clicking on this drop down to any privacy level higher than any staff member. So clinical staff only and beyond. I'll select clinical staff only and select my green check mark to save my changes and click OK. Please keep in mind that this change will not be retroactive. It will only apply to medications prescribed going forward. We can also restrict medication visibility at the patient-specific level. So we just saw how to do it at the global level. Let's switch gears and look at the patient-specific level. I'll close out of here, and I'm going to navigate to a patient's chart. Within my patient's chart, I will navigate to the Medications tab. Let's add a medication to this patient's med list by clicking New. And I'll begin to search for the name of an oral contraceptive. And select it. To prevent this from flowing automatically to the patient portal, I can update the visibility for this particular medication at the patient-specific level by navigating to the Notes/Visibility tab and updating my visibility here. Again, if it is set to any staff member, it has the ability to flow automatically to the patient portal. To restrict this, I want to select a visibility level higher than any staff member. I'll select clinical staff only and save. We can also review diagnostic test visibility at the global level. This can be done from within the clinical tab, within the Customize group, clicking on More and selecting Diagnostic Tests. We have the ability to search for a diagnostic test. In this example, I will search for our urine pregnancy screen. I may not want this test flowing automatically to the portal. So I have the ability here to restrict the privacy at a global level. To do so, I will click on my Edit button and navigate to my default visibility tab here. Clicking on the drop-down, I can change my default visibility so that it is anything higher than any staff member. I'll select clinical staff only and save my changes. I have now, at a global level, restricted this particular urine pregnancy test from flowing automatically to the patient portal. I'll click OK. We can also set global visibility for surveys. Let's take a look at how this is done. Again, within my clinical tab, within my Customize group, I can set global visibility for my surveys by clicking on More and selecting Surveys. Let's say I wanted to edit the visibility settings for the depression screen. I would select this depression screen here and click Edit. I have my default visibility field shown here. Again, anything higher than any staff member will prevent this particular survey from flowing automatically to the patient portal. I'll select clinical staff only. I'll then close out of my survey and I'll be prompted to save my changes. You'll want to review the article shown for more places in OP where you may need to restrict visibility settings at both the global and patient-specific level. Activity 3, archiving database records. As part of preparing OP for the patient portal, we want to archive database records. This process provides a wellness check on your database. What it does is it gives you the opportunity to take a large amount of data based on criteria and archive it. The reason we want to do this is because much of the clinical data flow is dependent upon data being in a certain stage. For example, for a visit note to be displayed in the patient portal, it must be finalized. This archiving process allows us to perform this function in bulk. Please keep in mind that in order to access your archives, you will need the following permission: admin_archive_records. The first thing that we'll want to do is review the data cleanup article, which is linked here on our slide deck. You'll want to decide as a team how best to complete this cleanup process for your practice. Let's take a look at this article together. In the particular example that we'll be looking at during today's session, we'll be navigating to our archive medical records. And from the Daily tab, we have the ability to choose to archive records for all providers or select specific providers from the drop-down list. We'll then choose a date for which we want to archive records on or before. Once we begin the archive process, what we'll be doing is that for all surveys administered longer than 30 days prior to the date that we select, where the review date is blank, this archive process will mark them as reviewed. For patient encounters and preventive exams, any unfinalized encounters written prior to the date that we select here will be marked as finalized and exit notes will be created. And for our general letters, this process will archive any general letters written for any patient so that they are no longer editable. Let's take a look together at how to perform this process in OP. To access our archive database records, we will navigate to the Admin tab in our ribbon and select our Archive Records button. This will open up our Archive Medical Records window and bring us to the Daily tab. Remember, step 1, we'll need to choose the provider or providers for which we'd like to archive records for. In this example, I will choose to archive records for all providers in my practice. I will select the dates for which I'd like to archive records on or before. We'll archive records with today's date selected, so for records on or before today. We'll then click Begin Archive to begin our archive process. It will ask me to confirm this action, and I will select Yes. And the system will then sift through all those records, and once completed, I will receive a pop-up note letting me know that the archiving process is complete. Completing the archiving of records makes the data unalterable, and this increases the integrity of the data. Again, you'll want to review this data cleanup as a practice and determine the best approach for your practice to take regarding the archiving of database records. Our takeaway action plan. Before joining us for our next webinar, we encourage you to use what you've learned in today's webinar to complete the following. First, running the appointment type cleanup sequels in an effort to perform your appointment type cleanup. We want to correct all those mismatched appointment types on our scheduled appointments, visit templates, and as defaulted in patient charts. You'll also want to review your patient record visibility settings. And then lastly, perform a database record cleanup for your practice. On our resources slide that is included in this slide deck, we have included a number of helpful resources that will be an integral part of your OP portal learning journey. The first article that we highly encourage you to bookmark is your OP patient portal learning journey. Let's take a look at this resource together. This is a great one-stop shop for information on portal features. If you expand the Before You Dive In section, this article includes steps that we've discussed in part 1 and now in part 2 of our patient portal series of what needs to be done to prepare your OP for the patient portal. For each action to take, we've included helpful resources that guide you through that process. We also have on this learning journey our live webinar schedule. This is where you can register or even re-register for these webinars. And then lastly, the learning journey, where we have included helpful resources to guide you along each step needed to take along your patient portal journey. We've also included all of the other articles that we reviewed together on today's session. The appointment type cleanup, as well as the 3 sequels that we used to run in today's session. We've also included our visibility settings articles, as well as that OP data cleanup article. Thank you all so much for attending today's session. Again, we will be following up to answer any unanswered questions via email. Thank you for your time today, and I certainly look forward to seeing you all on our future OP webinars. Have a great day.